right, the name of this lecture is Everything You Ever Wanted to Know About Management and Delegation. If you haven't already printed out these notes, you need to print these notes out first. Now, let me say something. You can't say that I haven't gone to the extremes to keep these lectures fun, all right? I'm in my favorite place in the whole wide world, which is Sandestin, Florida. And when you pass your boards, I want you to take you a trip too. You deserve it, okay? Now, let me tell you something. I'll have people that call me that have failed their boards, that have never taken my review, and tell me, Ms. Hurst, I only need help with management delegation. Don't give me all that med-surg. I just need help with management delegation. Well, let me tell you, until you've mastered the management delegation, you'll never be able to, until you've mastered the med-surg, you won't be able to get the management delegation. So you've got to understand your content first, your med-surg, your OB, peds, and psych, predominantly your med-surg. Then you can move into management delegation, okay? You'll see what I mean when we start looking at more test questions. So if you haven't printed out this handout, you need to stop right here and print the handout out first so you can go along with me. All right, so on your handout it says, what is delegation? Well, delegation is designating tasks to others, but the RN retains accountability. You see, that's what you and I don't like about delegating. You and I think that when we delegate something to someone, they ought to be accountable for what they do. Well, in the real world, that's not the way it is. You and I, the RN, is always accountable for what you delegate, okay? So that's why all of you need malpractice insurance. And by the way, if you need malpractice insurance, contact me. I know about that too. All right? Now, look at the next statement. You must always evaluate. That's one of your biggest responsibilities as an RN, to evaluate the delegated task, okay? Evaluate the delegated task. Don't just assume because you tell somebody to do something, it's going to be done properly. Well, we want to know things. Was the task done properly? Was the task done in the proper time frame? And is the patient all right? Because in the end, you are responsible for that patient. You see, y'all, and I'm afraid that this is a problem that's only going to get worse over the years, because we don't see a lot of people going into nursing like they used to. Even before, when there was a nursing shortage, people would hear about the nursing shortage and a lot of people would go into nursing. Well, we have a nursing shortage now, and that's still not happening. People aren't going into nursing like they used to. But what we are seeing is the training of more and more and more nursing assistants. So over the years in your career, you may see yourself delegating and managing other people more than ever. So that's why this has become such an important issue. Don't assume someone is competent to do something just because of their job description. Just because somebody's an LPN, don't assume they know how to do all LPN things. Just because someone is a nursing assistant, don't assume they know how to do all nursing assistant things. It depends on a lot of things. Let's look at some examples here. Let's say you've got a nursing assistant with 20 years of experience. See, 20 years of experience. That's to make you think, oh, 20 years of experience, they know everything. No. Has been working in the well baby nursery for the past 5 years. And this person has just gotten pulled to the orthopedic floor. And you have a post-op hip that needs to get up into the chair. Well, nursing assistants have been taught basic transfer and positioning of patients in their programs. I know that. But this nurse, I don't care that she's been a nursing assistant for 20 years. Where has she been working? In the well baby nursery. That's where she's been working. So her skills are really focused in on the well baby nursery, not on the orthopedic floor. If you're going to transfer an orthopedic patient, especially somebody that's a post-op hip, to the chair, aren't there some specific things that need to be done? Yes, in the transfer of that patient. You know, in the transfer of the orthopedic post-op hip patient, that they have to keep their legs apart, abducted. You don't want them to bear weight on the affected side or the surgical side. You don't want them bearing any weight, that sort of thing, okay? So you've got to be careful. So see, there are specific things that nursing assistant needs to know before they ever go and transfer that patient. If you've got, don't assume just because they're a nursing assistant they can go and do that just like that. There are specific instructions, concrete instructions that you must give before you ever let that nursing assistant transfer that patient. If you're unsure, go with the nursing assistant yourself and help them transfer the patient to make sure there wasn't any harm brought to that patient. Now look at the next statement. When someone is pulled to a new floor, pretend they are a new nurse all over again. Do not give this nurse any patients requiring specialized care. Okay, this happens all the time in hospitals. I may go to work in the medical intensive care unit where I've worked for the past 3 years, and when I get there and I take report on my patients, they say, the supervisor comes around and says, Marlene, you're going to have to go to the renal floor tonight. Well, I can't argue. I have to go. If it's my turn to go, I have to go. But when I go to that new renal floor, they are supposed to pretend that I am a brand new nurse. They don't look at, well, she's a critical care nurse. She's been working there. She knows what to do. Give her that side of the hall, and I'll take this side of the hall. That's not the way it's supposed to be done. You pretend they're a brand new nurse. Do not give me anything that requires specialized care. I've been working in medical intensive care. Don't give me somebody who needs peritoneal dialysis. I haven't been doing peritoneal dialysis, and it requires specialized care to do that. So you have to pretend I'm a brand new nurse all over again. That is the key to answering those kind of test questions. Let's look at the next example. We've got an ER nurse with 15 years of experience, and she gets pulled to the labor and delivery unit. Which patient would you give this nurse? Okay? Been working in the ER, pulled to labor and delivery. Brand new nurse once again. So, do you give me the patient with a severe DVT with bilateral involvement? Do you give me the patient in active labor? The patient who is 8 hours postpartum? Or the patient requiring fetal monitoring? Now, I want you to take about 15 seconds and think about that scenario. Well, I hope if I've been working in the ER for the past 15 years that you don't give me somebody in active labor. I pity the woman who gets me. If I've been working in the ER and now I'm giving someone who is in active labor, poor patient. The patient who is 8 hours postpartum. See, they tried to make it sound like no big deal. She's 8 hours postpartum. Well, even 8 hours postpartum, aren't there a lot of things that can go wrong during that time? Yeah. That's a high-risk time. What if you had to do a fundal massage and you've been working in ER for the past 15 years? You don't remember how to do a fundal massage? Now, a lot of people like to answer the patient requiring fetal monitoring. Not me. Just because I can read an EKG doesn't mean I know anything about fetal monitoring. See, that all of those things require specialized care. But any nurse fresh out of school ought to be able to care for somebody with severe DVT, a blood clot with bilateral involvement. But see, I made it sound really bad because I said bilateral involvement. Now, look at the next thing, UAP. Those initials stand for Unlicensed Assistive Personnel. Okay? Now, most of the time when you and I think about unlicensed assistive personnel, we think of the nursing assistant, the attendant, the clinical tech, whatever your hospital calls them. But y'all, it also means the ward clerk, the unit secretary, the EKG tech, the phlebotomist, the person from the lab, the person getting the EKG, anybody without a license. And guess what? You're responsible for every one of those people. So, until you've been working in a place for a while where you get to where you really know the people you're working with, you better watch who goes in and out of your patient's room. You're responsible for the person that goes in and out of your patient's room, and you'll be surprised what you find people doing to your patients, so you better be careful. Now look at the next statement. You are only accountable for what you specifically delegate, but be careful. They can always find a way to put the blame on you. That is why everybody needs their own malpractice policy to protect yourself and your assets. Okay, so say you did not delegate something and somebody takes it upon themselves to do something anyway, and harm is brought to the patient. You're not, as the RN, you are not supposed to be accountable for that task because you did not specifically delegate it. But the attorneys always will go for the person who makes the most money. Well, who makes the most money? The RN or the nursing assistant? The RN. So don't think you can't be sued because you didn't delegate the task. Look at the next statement. When someone does something you did not delegate and something goes wrong, your primary responsibility is to teach, teach, teach. You better teach and you better document that you taught. If harm is brought to your patient, you better be doing some documentation for yourself, whether it's an incident report or maybe you go home and document the incident. Very important to protect yourself. The incident report is basically going to protect the hospital. You need to go home and do some documentation yourself. All right. When you set a patient goal, can an LPN evaluate the patient to determine if the goal has been met? Now think about that statement for a second. No, the LPN cannot do any form of evaluation because evaluation involves assessment, and we never delegate assessment. Never delegate any assessment in any form. Now, when you're studying the nursing process, and I know you remember the phases of the nursing process as bad as you don't want to remember it, I know you do. Well, you've got the assessment phase, and you've got the final phase, which is the evaluation phase too. Both of those phases involve assessment, okay? So that's why we never delegate that. In the real world, I know LPNs can do assessments, limited assessments, but on this test, I never want you to delegate any form of assessment. They always want the RN to do it. So, who is supposed to do all admission histories? The RN. We want the RN to do the admission history. I know in hospitals you see the LPN do the admission because they're trying to help you out. Then they bring the completed form to you and say, sign this. You never should sign that form until you have validated the data, because when you sign it, you're saying you agree with it. As the RN, you are the only person with the education to look at the admission assessment and determine things from the patient's past, their past medical history, surgical history, whatever, to see if any of those things could affect the care that they are receiving now. So that's why they only want the RN to do that. Also, look at the next statement. Always consider a new admit unstable. You better write that word down, unstable. Anytime there is an unstable patient, the RN better be taking care of that patient. On this test, I want you, when you get a new admission, to stop what you're doing and go see the patient, because the patient is new. They're a new admission. They're unstable. The other people have been there for a while. You go and tend to that person first, and you'll get more questions right. If someone else, such as the LPN, collects the admission data, never sign off on the form until you have validated the data. Very important. Well, can an LPN devise a teaching plan for newly diagnosed diabetics? Newly diagnosed diabetics, that's just one example. No. Only standardized teaching plans. The LPN can only do standardized teaching plans, okay? Which means basic things, things that are the same for every single patient in the whole wide world. If you've got newly diagnosed diabetics, that's complex. The RN needs to be doing that. In a lot of nursing schools, I have found that the teachers teach the students to never let the LPN do any form of teaching. Well, LPNs can do teaching, but it's basic, standardized teaching. On this test, though, they really like for the RN to do the bulk of the teaching. It is your responsibility to figure out the staff's strengths and weaknesses. You aren't going to know these people you're working with when you start to work. You've got to get to know them, though. And when you identify a weakness, you're supposed to teach, teach, teach. You've got to learn the people you're working with. And it is okay to get people to repeat steps back to you. Like if we're talking about that orthopedic patient, and they're getting up, as a post-op hip, getting up to the chair, You can teach that nursing assistant the things they're supposed to do, abduction, no weight bearing, that sort of thing, and it is okay for them to repeat those steps back to you because you want to make sure they understand what you've told them. Now, 3 rules of delegation. Adequate information, you've got to give them a time frame and prioritize. You've got to provide adequate information. If something goes wrong and that lawyer can prove that you did not provide adequate information, they're going to get you. Also, time frame and prioritize. You've got to tell the people you're delegating to what you want done first, what you want done by a particular time. You don't just give them a bunch of things to do. You've got to tell them what you want done first and in what time frame. Delegation is not an assignment to another RN. That's making assignments. If I'm the charge nurse and I'm an RN and I'm making assignments to somebody else, when I make my assignment to the other RNs, they retain accountability for those patients, not me. Now, 3 rules of LPN delegation. LPN, sometimes called an LVN. Well, only nursing care in stable situations. Stable situations. Now, y'all, somebody can have a really bad disease and be stable. For instance, what if you had a 37-year-old with sickle cell in the hospital for dehydration? They've had sickle cell a while. Yes, it's a serious disease, but they're stable. What if I have diabetes? That is a chronic illness. The more chronic an illness is, the more stable it is. What if I have COPD? I know that's really bad, but if it took me 15 years to get COPD, I'm sick, but I'm stable. So don't let the disease fool you. You can have a chronic disease and still be stable. Orders not subject to change. If it's a complex order, do not delegate it to the LPN. You retain it for yourself. Also, selected tasks in unstable situations. Unstable. If a cold occurs, I do not want my LPN to leave me, but I will give them specific things to do, like get me a blood pressure, go get the crash cart. You give them specific things to do. Nursing assistants now. Non-complex tasks like, I know, routine vital signs, underline routine. You do not let them do the vital signs on the patient receiving the blood, on the patient that's got the dopamine going, on the patient that's got the nitroglycerin going, on the patient that's got the mag sulfate going. No, no, no. The only way I would ever let them do my vital signs on blood if it were the vital signs on the last 30 minutes of the blood transfusion. You see, I've got to make nursing decisions based on those vital signs, so I've got to make sure those vital signs are correct. Basic communication, CPR. Now, a lot of people say, CPR, I need to do that. Well, everybody in the hospital has been trained to do CPR. Your time is better spent helping the doctor, pushing medicines, that sort of thing, putting in chest tubes, whatever the case may be. Now, when you see people doing CPR, it is your responsibility to make sure they're doing it correctly. And if they're not doing it correctly, you stop them right there. You do the CPR for a few seconds and show them what they're doing wrong. You've got to make sure they're doing it right. All right, the next thing is post-mortem care. We're not going to hurt anybody now, are we? Very important. And identify risk. Most nursing assistants in their program have been taught how to report back to the RN if they see a patient trying to get up out of the bed, that sort of thing that's at risk for falls. Always teach your nursing assistants to report back to you. That may be something new. That may be something they've never had to do before. But you want them to get into the habit of when you're working to report back to you on the condition of your patient or on the task that you've given them to do. Now, let's talk about trivial tasks and test questions. Trivial tasks like feeding a patient. In the hospital, you know that the nursing assistants always are the ones to feed the patient. But, you see, feeding a patient is a trivial task. But if you've got somebody who's had a stroke, don't you dare delegate that task of feeding because there is a degree of harm. There is a degree of harm. That's the way they can get you. They'll give you a trivial task And you'll think, oh yeah, I remember in clinical, the nursing assistant always did that. Well, you better watch out, because there are trivial tasks that can harm certain patients. So, if there is ever a degree of harm, the RN must retain the task for themselves no matter how trivial it is. To delegate properly, you have to plan at the beginning of the shift. You're a manager now. You're a manager of patient care. The head nurse is not the only manager on the floor. You are a manager, and you've got to take time, get there early, and plan out the day for your patients. And know that the day is never going to go according to the plan. So be flexible. Never delegate something that requires nursing judgment. If you'll remember that sentence, that'll help you get more questions right. And anytime an RN's judgment, assessment, or problem-solving skills is needed, no matter how trivial, the task should not be delegated. Put a star by that statement. That'll help you get more questions right. And always keep cost effectiveness in mind. Remember that when you're answering test questions. When you're looking at 4 answers, if you see something there that's more appropriate for the nursing assistant to do, or maybe you can send an LPN to do that while you deal with something more acute or more complex, then that's what you need to do. Okay? Now, remember, to get management delegation questions right, you've got to know your content first. So you've got to learn that first. And then you practice lots and lots of test questions that are management delegations, and you should have those on the site ready for you to practice. You'll never get good at those kind of questions until you know your content first, and then practice a lot of questions, okay? And remember, y'all, on the test, you're never going to get questions where you just pick an answer and you know you got it right. All we can hope to do is improve your judgment. It's not going to be like a test at nursing school. You're not going to come out and be able to figure out, okay, I missed this one, this one, this one, and this one. You're not going to know what you got right and what you got wrong on this test, and that's okay. We're just improving your chances of getting more right than wrong. All right, thank you for listening.